This dress is decorated with over 6,000 contraceptive pills. That's enough to prevent pregnancy for 26 years. This is Pharmacopoeia Come Dancing, a 1998 artwork by Susie Freeman and Liz Lee, and is on display here in the Welcome collection. It was inspired by real conversations with women about contraception. Today, over 100 million people around the world use oral contraceptives, and the most common type is the combination pill. It contains a synthetic version of two key hormones, estrogen and progestin. So how does it actually work? Well, you can think of your menstrual cycle like this. Every month, your brain sends chemical signals to your ovaries saying, release an egg. And these signals are hormones called follicle-stimulating hormone and luteinizing hormone. And when they arrive, they trigger ovulation. At the same time, your uterine lining thickens with tissue and blood vessels, creating a supportive environment. And if that egg gets fertilized, it attaches to this lining. That's pregnancy. If not, your hormones shift, the lining detaches, and you get your period, which is a mix of that tissue, blood vessels, and the unfertilized egg. The pill interrupts this process. By giving your body doses of synthetic hormones, it essentially tells your brain, don't bother sending those signals. We've got enough hormones here already. And as a result, no egg gets released, and no ovulation means no chance of fertilization. But the pill doesn't stop there. It has two backup plans. First, the progestin thickens the mucus at your cervix, and this makes it harder for sperm to get through the uterus into the fallopian tubes where fertilization would happen. Second, it changes the lining of your uterus. So if an egg did get fertilized, it's harder for it to implant and start developing. So here's something interesting about periods when you're on the pill. When you're on hormonal birth control, you don't ovulate at all, but your uterine lining may still thicken. And so when you take that pill-free week, the drop in hormones triggers your body to shed this lining, but it's not the same as a natural period. There's no egg present, and so the hormonal balance is different, and the lining hasn't gone through those gradual, natural changes. And that's why many women notice that their periods feel different when they're on the pill. They might have different flow, different symptoms, sometimes they're lighter, sometimes they're shorter. It's super effective when it's taken consistently, and when it's taken perfectly, it's over 99% effective. But as you can see, it is a daily commitment, and this artwork is a visual reminder of the science, the choices, and the lived experiences behind every single pill. Contraception isn't a one-size-fits-all, but understanding the biology behind it helps us to make better and more informed decisions.